Good afternoon, Minister. Last week you indicated that you may mandate a return of COVID masks this winter, but according to a major report by Ofsted in the UK earlier this year, there's evidence that face masks could have stunted many children's social and language development. So I'd like to ask, based on these known risks, what real-world evidence do you have that masks significantly reduce the spread of COVID-19, not based on models, but actual real-world examples?
So first of all, there is no expectation that we will be moving to mask mandates. Obviously, Ireland, as with every other country, will have contingency plans in place should there be a variant of concern that outcompetes Omicron, that has a high ratio in terms of severe illness and that escapes the vaccines. The public health advice I have is unambiguous on the use of masks. Masks are important. We have public health advice in place right now. They do work, they do save lives, and they have been an incredibly important part of our response to the pandemic.
Minister, what real world examples do you have of that other than just saying they work? I mean, what's the data?
I mean, there's oodles of data. There's data all over the world. Like there is no serious argument being had in terms of whether
I think there's a lot of doctors who would disagree with you on that. If I can
just finish, there is no serious argument being had in the medical community as to whether face masks are an important public health measure. Are there trade-offs? Are there trade-offs in terms of children wearing masks? Yes, there are, and those things are taken very seriously, and they are, they are accounted for in terms of the public health advice. But in terms of living through a pandemic, there is no serious debate as to whether or not face masks are an important public health measure.
Could you name a real-world study that shows that?
I will ask the Chief Medical Officer to send you any number of studies to that effect, yeah. No problem at all.
That's all we have time for.